The Scout Guide is a city guide dedicated to supporting local businesses here in West Texas. Welcome to Inside the Scout Guide, West Texas, a brief look into a few of the exceptional businesses right here in Midland and the entrepreneurs who lead those businesses. I'm your host, Jay Whitlow, and today I am pleased to welcome into the Second Story studio from Vitality Psychiatric Services, Tammy Vaught. Welcome to the Catwalk.
Thanks, Jay. I'm really glad to be here, finally.
Finally, we've had a little bit of a difficulty getting you
Scheduled,
here.
yeah.
Your son had some issues. We were talking before off camera, his problems with his foot and ankle and everything. So he's good.
He's good, and now we get to be here.
So let's jump right into all of this. Tell me a little bit before we look at your business. Tell me your backstory, kind of where you're from. Get me through a little bit of childhood until maybe adulthood.
Okay, so I grew up in San Angelo, so I'm a West Texas girl. So being here in Midland's a little strange, cheering for teams that were my opposition growing up, but we're making it through. I entered the healthcare industry at a young age. 21, I started working in an emergency room as an emergency room tech, and went on to become an emergency room nurse, went on to ICU nursing, and ultimately I became a Certified Registered Nurse Anesthetist or anesthesiologist. So that's a master's prepared nurse that does anesthesia in the operating room. I got that degree while my husband and I were living in Michigan. Our path took us to Michigan for about 12 years. We both went to grad school in the Midwest and were working in the Midwest. And I decided to go back to school and become a CRNA. In 2011, his path brought us back to Texas. And so we moved here for his work, and I started continuing my work as a nurse anesthetist, working in a variety of hospitals in West Texas. I was travel nursing at the time, or travel CRNAing, and so I was working at every small community hospital within about a 250 mile radius. I would go in and cover vacations. When like a CRNA needed to be out on vacation, I'd go in for a week, cover their vacation, and then come back home. So it put me on the road a lot, but it let me see a lot of West Texas and a lot of different small town environments doing anesthesia. And in 2016, 2017, I kind of settled in here, and I was doing anesthesia for a local plastic surgeon in his office. I was his private CRNA, really dedicated to just doing anesthesia for him. And I kind of really thought that was just going to continue to be my path. I didn't expect to shift gears, if you will. But God had different plans, and I went down a completely different path that I wasn't anticipating. I had a really dear friend who was suffering from chronic pain and treatment-resistant depression, and I was just really trying to find something out of the box that might be helpful for him. He really felt stuck, and nothing was working, and so I started doing some research, looking for something different. And ketamine came up in my research, and I'm really familiar with ketamine because that's an anesthesia medication. I've been giving it in the operating room for 16 years, largely to treat surgical pain is why we give it in the operating room. But lo and behold, it was being used in outpatient clinics to treat mental health and to treat chronic pain. And so I had no idea. The chronic pain piece made sense to me because I use it in the OR to treat surgical pain, but I had no idea that it was gaining any kind of momentum with treating mental health. So I started reading, researching, looking for articles, just trying to get a handle on it. And so then I went to go look for a clinic for him. And there were no clinics in West Texas. The closest thing would have been in the Metroplex. And even at that, in 2017, there were probably only about 5 ketamine clinics in the state. It was very new. It was very just on the cusp of the horizon of even being considered as an option. And so because of my situation, the private anesthesia I was doing for this surgeon, I said, hey, do you think it would be possible for me to use a little bit of your space? Consider opening what at the time was Ketamine Clinic of West Texas. Open this clinic, and really in my mind, I was like, if I can get all the protocols in place and do everything justly, if I can just treat my friend, get him what he needs, and then shut it down and keep doing anesthesia, that was in my mind, the direction of where I was going. And then now here we are, 7 years later, still doing ketamine therapy for mental health and chronic pain. But I became so passionate about mental health. I was passionate about mental health anyway, but seeing people evolve through this treatment just really blew the doors open for me. And listening to their stories and holding space for people while they were talking about their significant traumas and life experiences. I just wanted to find a way to even further my reach, and how could I be able to help more people in our community, because ketamine therapy is not for everybody. It's not the route for every single person that walks through my door. So in 2020 and 2021, I went back to school and became a psychiatric nurse practitioner as well, and opened what now is Vitality Psychiatric Services. And the real purpose for that was kind of multifactorial. In the ketamine arena, there was a little bit of like this push and pull of who was the most appropriate provider to provide ketamine therapy. Would it be an anesthesia provider because we're using an anesthesia medicine, or would it be a psychiatric provider because we're treating mental health? And having someone that's trauma informed and understands the medicines people are on and the diagnoses. So part of my reasoning for going back to school was to make sure my patients felt really well supported with my knowledge. But I also knew that there was a gap in our community of not enough psychiatric providers. So I opened the psychiatric arm of my practice, which is Vitality Psychiatric Services, to be able to offer traditional psychiatric management, and to be another layer of support to my patients that were already seeing me for care, but then also for patients that call who aren't interested or not appropriate for ketamine therapy but need support. And that way I can say, well, hey, you know what? Ketamine may not be the right choice for you at this time, but we do have these other services available. Would that be anything that would be of interest to you? And so now the psychiatric practice, the Vitality Psychiatric Services, which is in the Scout Guide, that business or practice is now, I guess, in its second year as a full scope psychiatric practice.
Right.
And then the Ketamine Clinic of West Texas is still an active business and part of what I do. They kind of merge together, and I have patients that are on only the ketamine side or only the psychiatric side, and plenty that have crossed and bridged to both businesses or both practices.
Well, I want to unpack your business because I think it's needed. I think it's something that I would say probably maybe 10, 15 years ago wasn't that prevalent around, even though mental health has been around for a while. Would you say in your best practice that mental health is coming around from not being a taboo subject anymore?
I definitely think we are making huge strides in that direction. It definitely, I remember growing up as a teenager and being, whether it was just teenage angstiness, or I would probably say that I dealt with anxiety and depression as a teenager. And I remember my mom being very concerned and saying, maybe we should get you some help. And I was like, no, I don't need any help. I don't need that. And I think, and that was not that long ago. I'm 48, so I wasn't a teenager that long ago. And over the years, I've definitely seen it gradually evolve. I mean, even my experiences as an ER nurse, how patients were treated when they came in with suicidal ideations or psychosis versus now how they're treated, there's definitely been an evolution. I love that athletes and people in high positions that have great platforms are speaking out about their own battles, their own struggles, which I think is really putting a lot of light and saying, hey, we were never meant to do this life alone. And loneliness doesn't have to be a part of your story. You can give yourself the moment to let yourself be vulnerable and possibly just like open things up so that you can work towards healing and having this one great life that we have.
Why did you choose the name Vitality? Does that have a significant meaning?
Good question. I think that I was looking for something that was just more, didn't sound so clinical and so depressive and so normal. I mean, as far as like if you're looking for psychiatric care, a lot of times you just see a physician name or you just see mental health care, or, it just sounds so drudge. And I wanted Vitality to sound exactly what it is. Like we're hoping to, through the various services we have, to elevate someone's life so that they can experience vitality in their everyday living.
Right.
So thinking back on it, I don't know if I put that much thought into it, but I think that it really speaks to what we're doing, and so it fits.
I think that's a really cool name. It does speak with energy. I think it kind of puts it out there. It's not a negative word. Vitality.
Right.
I'll always see that as a positive word.
Yeah.
So I think that's great. I know we just came out of September. September was Suicide Awareness Prevention Month. I know we were trying to get the episode during that time.
Right.
Could you speak to that, what you are seeing in that space right now and how you're addressing those needs?
Yeah, there's always been this conflict of interest back and forth as to whether or not should we talk about suicide, or does that make it more prevalent or more scary? People feel like if they say it, then that means what? Then more people maybe will lean into that, or it'll bring some kind of weight to the situation. But I think that that's exactly what we need to do, is bring weight to the situation and also make it where it's a word that's spoken just like happiness and joy and vitality, or depression, anxiety, and suicidality. If these words are all words that we can just say with freedom and not feel like we have to be hush-hush about it, well, then that is life-saving. Giving some permission to say, you know what, I'm really struggling, and I've even had some thoughts that I wished I was unalive, and I don't really know what to do about that. Then someone can go, well, I felt that way, and I went and got this help, and I did this. And maybe it's not the right help for you, but it's a place to start and see if this person or this path could be an answer for you.
Well, I appreciate you sharing the inspiration on walking through why you started the business. And of course, we talked about the name and how it's positive and uplifting. When you started with the ketamine, am I pronouncing it right? Did you have any challenges or struggles with that? Was that seen as negative, positive? What were you facing in that space?
Yeah, Jay, it's still a challenge. Because of ketamine's vast history, it's not a new medicine. It's been around since the 60s, and it was actually developed as what they called a buddy drug for soldiers in the Vietnam War to carry in their pocket. And because you could give it as an injection to your buddy that went down, say got shot, and it's going to provide him with some pain relief, a little bit of sedation, but not affect his airway. Like most of our anesthesia medicines make you stop breathing or make your breathing become shallow. Ketamine doesn't do that. It maintains your breathing. So it was a really safe drug for them to shoot it in the leg in a soldier in the battlefield and get them to security and to a safe space to continue their health care. It's an old medicine, but it's had a tumultuous history. It's been abused It's been limelighted as this party drug, and then it's been squashed as a party drug because other better party drugs became available,
Right.
and it got lost in the shuffle. It's used in veterinary medicine so that was at the very beginning. Everyone's like, why would you be giving a horse tranquilizer? And it's like, well, it's been used in in human medicine as longer than it was used in veterinary medicine. So there were immense amounts of challenges. And any medical practice that's being started has an array of challenges that maybe a traditional business might not have. Now, of course, lots of businesses have tapes they've got to figure out and rules they've got to follow, whether it's a restaurant and they're trying to jump through all of the many hoops to be safe and in code. But a medical practice is obviously even a whole nother level because we're talking about people's lives. There has to be malpractice coverage. There has to be rules and regulations at state and national level. Even for me, I'm an advanced practice nurse, so I'm not a physician. So that puts another level of challenge because I can't just go and put up a shingle and start treating patients. I have to have what's called a supervising physician who is my collaborative doctor. We went over my protocols in advance. I told him this is what I'm wanting to do. This is why I want to do it. This is how passionate I'm about it. And he has to take a chance and say, okay, I'm willing to put my name on that too. And I trust you that you're going to do good, ethical, safe work. And so I started my practice very untraditional, and it has evolved over the 7 years, continuing to mold and optimize and make sure we're doing best practices. Because honestly, when I first started this in 2017, it was really new. There weren't a lot of resources. There were only 5 clinics in the whole state of Texas.
Right.
I was the first CRNA-owned clinic in Texas, and there definitely wasn't one out here. And so digging and talking to providers around the country to try to figure out how do we make this so that it feels safe to people, there's validity in it, there's minimizing questions of whether or not this is something that is not beneficial to patients. So yeah, there are a lot of barriers, let alone West Texas tends to be obviously far more conservative. And so often new and innovative things sometimes take a while to get to us, unless it's innovative in the oil industry,
right,
which obviously we're blazing the pathways with that, but everything else is a little bit slow to join into this space. And so me bringing something that was so new and so out of the box definitely was met with a little pushback initially.
That's a great segue into what I want to ask you now, because most of the businesses that are in the Scout Guide that we've been interviewing have shared how they stay competitive in the market. It's a little odd maybe to say, how do you stay competitive in this, but how do you deal with other services that are out there that may provide? You said you're the only one with ketamine, but there's others that are helping mental health and factors like that. How do you set yourself apart? What makes you different maybe than another business?
I talk about this a lot because to me, it feels a little predatory. If you're advertising for psychiatric care, that means that you need people to be sick. You need people to be hurting. You need people to be dealing with strife in their life and depression. And I mean, sure, I would love for that to not be the case and me to be like, well, hey, we got to shut it down. I need to close this business, count it as a really great 7 years, and know that I helped walk alongside thousands of people while they transformed their lives. And now Midland, Odessa has no more depressed people, nobody with PTSD, no one with anxiety, no one suffering with suicidality. And I'm no longer needed. I go back to the operating room and do anesthesia. And so it's been kind of hard for me as a daughter of a man who owns an advertising agency and has for my whole life. I know a lot about marketing and advertising. I've lived it, watching him help people soar their businesses. And I'm like, Dad, I can't be predatory and be like, are you suffering? Call us. So I really feel like what sets me apart is just presenting a space where people feel like that they can be themselves. I talk a lot about we provide a really safe and peaceful space. My office is very relaxing and comfortable. People say, I just want to come and hang out in your waiting room and just, I feel like it's therapy just to sit in your waiting room and get away from all of the noise and just be quiet. I offer a lot of different things. It's not just traditional psychiatric care where you come in, I listen to you and I write, and then I say, you're depressed, take this medicine. I talk a lot about, I want it to be a collaborative relationship where the patient really feels like they're a part of their own care. They're helping to make the decisions. I present options. I present least invasive to most invasive, like options of how to optimize your mental health. A lot of times I'll talk about it on kind of like a tiered schedule, tier 1 through 4, and building through the tiers to optimize your mental health. But a couple of the things that I do offer that nobody else offers is I do genetic testing. And I think there's a couple of other psychiatric physicians in town that maybe do that. But it's not as prevalent here as it is in some other markets. So I do genetic testing, which helps us to narrow down what medications we might prescribe, look at some of the genes that are specific to mental health and see if there's some variants that even just supplements could be helpful for. Within my space, I have some really great licensed therapists that are not employed by me. We just work well together and really admire the work each other do. And so we have a really great networking and cross-referral base. So patients can often come and see me and be supported by me, whether it's through medications or supplements or diagnosis, whatever they're needing. But they can also see a therapist. And then, of course, the ketamine therapy is very unique, and I'm the only one in West Texas that offers that.
Wow.
I feel like there are some providers locally that are what I consider to be kind of dabbling in it, which is concerning for me because it takes a lot of very dedicated care to guide someone through a psychedelic experience, which is ultimately what's happening with ketamine therapy. And it takes very, very focused attention and compassion and work on my part. And if someone thinks they can just kind of dabble in it, prescribe a little bit of it, mention it, hey, maybe just try this once. I've spent years now of studying it, evolving my practice to make sure that I'm with best practices with the national associations that are been formed for ketamine therapy, constantly reviewing protocols and research studies to tweak and make sure we're doing things well. Man, there's patients from 2017 that I wish I could go back and be like, come back. We do things so much better now. Right. Like we do things so much better now. But because of the fact that what I'm doing is so unique, I haven't yet had a situation where I was like, oh, now I have a competitor. Another ketamine clinic has opened in this town. And so we have to figure out how we want to do things so that patients want to be with us. I think my patients would tell you that if another clinic came into town, they would have no reason to go seek and say, hey, we want to see what your clinic's like, because they feel really well cared for by me.
Wow. Loyalty too, maybe.
Yeah.
Did the pandemic have any effect negatively, positively to your business?
Honestly, no. We had to do things a little differently, of course. We had to stagger patients a little bit further apart. All of the patients' rooms are private when they come in, and so no one's even sitting in a waiting room. I run a very tight office, and so people check in at the front desk, and they're back in a room within a minute or two, and they know that. And so the cross of like being exposed and that kind of thing really wasn't a factor. And my patients, of course, were the ones I was treating actively at that time were really worried that I was going to shut it down or not be able to see patients. And I'm like, no, we're not doing that. This is important work we're doing here, just like any medical frontline treatment.
Right.
Just because it's mental health doesn't mean it's not
going to take a vacation.
really, really
Yeah.
important. And so we kept operating. We just spaced patients' timings out, made sure that they weren't spending time in the waiting room. And really that's kind of just stayed the same. I would say it probably bolstered my practice afterwards, because I've treated many frontline workers that had healthcare burnout from trying to like just stay above water during that whole scene, that have left healthcare because of it. I've treated a lot of nurses and doctors. And so there was probably a little bit of a bolstering of my patient load after.
Because I'd heard that from the pandemic, mental health even skyrocketed even more.
Yeah.
So I would assume
Isolation.
you probably saw a lot more, a variety of people. You mentioned seeing more doctors than maybe you've seen before.
Right.
So I want to shift a little bit to talk about you as a business leader.
Okay.
How do you handle work and family life balance?
Early on, I didn't do a very good job of that, honestly. This was a new practice for me. And so setting boundaries in mental health care with your patients is really challenging. And early on, I didn't do a very good job. I would answer texts while I'm sitting on the couch watching movies with my family. I would step out of a restaurant to answer a phone call. And that was not great practices. It did not serve my patients well, and it established a codependency. It did not serve my family well. And when I recognized, like, no, this is a long-term plan here. Like, God has turned my path into being actively working in mental health. You've got to do better. And so I have a lot better boundary setting with business hours and not answering phone calls and making sure my patients understand. Like, I will check messages on Sunday nights. That way I can check and see if you've had or needing to cancel or change or things like that. But I'm not going to be accessible during the, once I leave the office space. It has actually afforded me the ability to have much more flexibility with my family now that my kiddos are getting older and we're in sports and we are in more extracurricular activities after school. I can adjust my patients and my infusion days and my psychiatric appointment days to kind of mold to our season that our family's in. Maybe it means I'm seeing patients earlier so I can be done by 3 to go do pickups on certain days. Maybe it means I pick up a Saturday once a month so that I can free up a Wednesday to be at ball games. When I was in the operating room, and I still do anesthesia probably two to 5 days a month, but when I was doing anesthesia full time, you're in that operating room at 6 in the morning and you work your shift, and that may be till 7 p.m. It may be till 3. It may mean you're there on Christmas. It may mean that you're working nights or weekends. And you are definitely not as flexible as owning your own business. Right. And now that I've been doing it long enough, I can, with confidence, give myself those flexibilities and say, no, I'm not going to see patients on these afternoons, or I'm not going to sacrifice this time with my family to accommodate 20 patients this day.
Right.
My son just came to the realization not that long ago that when I was working in the operating room, I was probably making 3 times what I make now, probably what I bring home. And he was like, why are you not, go back to the operating room? He's wanting things. Right. He's wanting things. He's wanting trips. He's wanting things and trips. And when I say, babe, this is why we have a budget, and trying to teach him responsibility with finances. And he's like, go back to the operating room. And I'm like, yes, while the financials were beneficial of working in the operating room, the flexibility of me being able to run up to school when something goes wrong, or me being able to be at all of your games and never miss one, and me being home on Christmas morning, all of that was compromised when I was in the operating room full time. And then he's like, well, we would probably be okay. He just wants the things right now.
Just wants things. What are some practices or habits that you're doing as a leader to make yourself a better employee, a better owner, a better leader? What are some things that you're doing to engage for yourself?
I think that probably the best thing I can do for everyone around me, whether that's my employees, whether that's my patients, whether that's my family, is making sure I'm really diligent with my own self-care. I exercise, I journal, I write a lot, especially if I've had a really heavy month with patients that have a lot of really, really heavy burdens, or burdens that are maybe similar to some of my own life experiences. That can become really challenging when you're working with someone that has a really similar experience as you have had or that you've worked through. So I make sure that I'm really in check with those kinds of things, checking in with my own mental health. There's been periods of time where I've reached out to my own therapist that I had years ago to be like, we need to do a couple of check-ins because I'm carrying some really heavy stuff right now, and I need to make sure that it is my stuff that I'm carrying in the backpack and not everybody else's. And I need to evaluate the backpack and offload the things that are not mine to carry, because sometimes you start to carry everybody's stuff that you've been listening to day in and day out. So I think that makes me be keeping my own mental health and my own physical health and my own spiritual health in check makes me better for everybody. From a business perspective, honestly, that's an area where I feel like I need mentoring. I've even talked to some business owners that are way next level and said, I feel like I need some mentoring on how to take things to the next level, how to better support my employees, how to ratchet this up to what does the next thing look like. And just recently I was talking with Colin Sewell. I don't know if you've met him or had him on here. And he made a recommendation of a book that he said is the first book he recommends to all people that he mentors. And he's not mentoring me at this time, but he said, this is my starting place. And so I just ordered that book. And so I'm actively always trying to look at ways to be better.
Can you share what that book is? Because I think I know what it is. It's John Maxwell?
Yeah.
Yeah.
Yep.
Yeah.
It is.
It's a great book.
Yeah.
I want to kind of wrap things up here.
Sure.
I appreciate your time.
Yeah.
Where are you and your family, and more importantly, maybe your business, involved in the community? Are you guys volunteering anywhere? Do you support nonprofits? What does that look like as a business owner?
Yes, definitely. We are active members at St. Luke's United Methodist Church, so a lot of our volunteering comes through opportunities through St. Luke's. I have personally been really involved in a couple of different nonprofits in town. I was on the board for Breaking Bread for a long time, and prior to being on the board of Breaking Bread, I did at least one morning a week, if not 2 mornings a week, rode out on their breakfast truck to take food out into the homeless community, and I became really, really active in that scene. So I still, even though I'm off of the board and my schedule doesn't allow me to go out as much as it used to, I still very much support ministries that are trying to help elevate people up off the street, whether that's Breaking Bread or Midland Soup Kitchen or Field's Edge, which I've worked a lot with John Mark in helping not only what he's doing, but supporting it financially and with vehicles and things. I love what he's doing. And so that subset of ministry, and then also Reflections Ministry, which is helps. I think it was just women, but now I think it's women and men that have been in sex trafficking, and they're trying to break free and get into a transformed life. And so I've also been very supportive of Reflections. I've actually taken my son out in the morning to deliver meals to the homeless, and that was an eye-opening experience for him, but it definitely makes them aware when we're driving. They ask a lot of questions, and it generates a lot of really good conversation.
I've gone out a couple times on that Saturday morning.
Yeah.
delivering, and very supportive, a huge advocate for the any organization that's helping with homeless in our community. So I appreciate that. I applaud you for that. Yeah. What would you say if there's someone who's listening, watching, they're wanting to start a business, they find themselves maybe where you are, they're in that, I don't know if I want to launch this, I don't know what steps to take. What would be your one advice that you would give a new entrepreneur?
I think it's about finding passion. And so really finding what it is that's driving the fire. Because if it's just like, ooh, I think I might want to, it's cool to have a business, or maybe it'll be this great thing that I'll launch and I'll become a millionaire. Like if it's a financial, for financial gains or whatever, I feel like it's going to become so burdensome that it could easily be lost in the shuffle. But if it's something that you're truly passionate about, that you feel like could transform, whether it's lives, in my case, or community, or an organization that's going to elevate people up off the streets, right. It has to come from passion to me. It has to be fire. It can't just be like, I want to give it a try to see if I can be the next big thing. There's got to be a why. And that's literally the only reason I came out of the OR was because I had somebody that I felt really strongly about helping. And so the passion and the fire led me down a whole new path.
I think the Scout Guide is in volume 3 now. I don't know how many of those you've been a part of, but most recently the red edition is the newest.
Great, it's beautiful.
What has being in the Scout Guide done for you, or what does it mean for you to be in something like that in this community?
Well, the Scout Guide is such a beautiful publication. I love what Claire's doing with it and how she highlights businesses in our community. I was in it from the very beginning, but not as Vitality Psychiatric Services. So this was my first year as being my own page with my own business and truly highlighting what I do. So it's kind of a left to be seen as far as how it helps my business grow, or if I have patients that come and say, hey, I saw you in the Scout Guide. Like I haven't experienced that yet. The guide just came out a few weeks ago or a month ago. But just alone to just be in pages with such amazing young people and people that have been in the business forever. Like people that have been in business for 50 years, but also young people that are just trying to make an impact in our community. I love to be a part of it and just be encouraging them, but also learning from those that have been long before me doing exceptional things in our community.
Wow. Well, thank you for your time. I appreciate it. I'm glad we got to hook up and finally get this done. So thank you. I applaud you for what you're doing in our community and helping those who are struggling with mental health. And so thanks again for your time. Thank you for joining with us. That'll do it for us here. Big shout out to Chris producing Second Story for the studio space. Obviously, Claire Ramirez of the Scout Guide West Texas. Thank you, Tammy, for being here. Like, share, and subscribe on all of our platforms. And thank you again for joining with us on Inside the Scout Guide West Texas.